I'm in a freezing cold hospital suite, flinching as a cosmetic surgeon prods my naked breasts. It is my first consultation at the Aurora Clinic in Buckinghamshire with Adrian Richards, who is sizing me up for a breast implant operation. His cherry assistant advises that I should consider the bigger of the two implants I've been shown. They'll be 5% smaller once they're inside you. The last thing you want is for them to feel too small, she says. Next, I'm handed a skin-tight sports bra, into which I'm instructed to stuff a pair of rounded silicone sacs. A few pictures are taken and my bust to be as advised, roughly a D cup. Aren't they too big? I ask. At 5 feet 4 in, a size 8, and naturally a 32B, I feel top-heavy. Not so, I'm assured. I leave feeling a mixture of exhilaration at the idea of a transformed body and slight panic, as if I've just bought a car that's slightly more expensive than I can afford. In reality, though, I'm being sold surgery. In the best-case scenario, the £5,000 operation will give me a bigger bust but also can cause scarring, loss of nipple sensitivity and difficulty breastfeeding. Aside from post-op pain, the possibility of infection, and a 1 in 10 chance that scar tissue inside my breast could harden, necessitating the need for another operation, my implant could rotate 360 degrees, leaving my chest misshapen. I could develop a potentially fatal infection and even contract a rare form of cancer estimated to affect as many as 1 in every 3,000 patients. Not that my doctor verbally warned me about any of this during our discussion, although, according to recently drawn up ethical guidelines, he should have. Seeing my enhanced silhouette was curiously thrilling. But I also breathe a sigh of relief that, in reality, I'm not actually planning to have a boob job. What Mr. Richards does not know is that I'm a journalist and my visit is part of an undercover investigation into the practices of British cosmetic surgeons offering breast augmentation. Although Aurora claims that a second consultation, during which risks of surgery are outlined, is standard protocol, I was not offered such standards. In fact, 2 weeks after that initial appointment, a receptionist offers to book my surgery for a fortnight later. If I had taken up the offer, the next time I would have met my surgeon, and been able to ask any medical questions, would be shortly before going under the knife and, importantly, after I'd paid a deposit. Even more concerning, Aurora informed me after the investigation that I'd signed a form that apparently stated the risks of surgery, something of which I have no recollection. If I, an astute journalist investigating the issue, failed to notice this small print, how on earth would others? I wonder how anyone could make an informed decision to go ahead without being told clearly in conversation of the potential downsides. At this point, you have already been lured in by the prospect of an enhanced body and it would undoubtedly feel difficult to back out. A cut price offer and hard sell tactics. Of the 5 clinics we investigated, 2 were found to be fully adhering to best practice rules. But alongside my worrying experience, we also uncovered evidence of hard sell tactics. One surgeon suggested a patient inquiring about breast augmentation also have fat-removing liposuction, and another clinic offered a discount if an on-the-spot booking was made. This kind of approach is prohibited by government-backed guidelines, published in 2016, that hold the cosmetic surgery industry to account. The reason: these tactics can pressure women to choose a life-changing operation. Our inquiries were spurred by growing concerns among doctors that women undergoing breast enhancements are not being properly warned about a new form of blood cancer linked to implants. And, as my experience at Aurora illustrated, some doctors are not verbally warning women during their discussion with the patient of the risk. Known as breast implant-associated anaplastic large cell lymphoma, or BIALCL, it is rare and usually curable with surgery, radiotherapy, and chemotherapy. So far, 57 British women have been diagnosed and 3 have died. The worldwide death toll is 16. The disease is a prime concern for health watchdogs due to the growing number of cases and a lack of firm evidence about why and how it develops. BIALCL can take anywhere from 2 to 30 years to cause symptoms, which include swelling and hardness of the breast due to a buildup of fluid around the implant. Health Watchdogs, the Medicines and Healthcare Products Regulatory Agency, MHRA, estimates that 1 in every 24,000 boob job patients will suffer BIALCL. But in May 2018, this newspaper reported the startling findings of scientists who estimated it could affect up to 1 in 3,000 patients. Professor Anand Deva, of the Australian School of Advanced Medicine, claimed the number of reported cases soared by 50% in 2018. BIALCL appears to be associated with a type of silicone implant with a textured, rather than smooth, surface. The rough shell sticks to the body's tissues and prevents the implant from moving, making it easier for surgeons to achieve a consistent and pleasing result. It is thought the microscopic pits in the surface provide a breeding ground for bacteria, which may lead to an immune response that triggers the cancer. Others suggest BIALCL could be due to a reaction to the silicone, meaning a ban on textured implants, used in more than 95% of British breast augmentations, would not protect women.